Hello everyone, good evening. I'm Steve from UCAN English Tutoring. In this video, I'm going to discuss the case notes of one of the recent OET writing examination. So this question paper has been asked on the 17th of December 2022, just about 2 weeks ago. So we will go through the case notes for everyone. The first and the foremost thing we need to do is not to read the case notes from the top. I mean, do not read from here. The reason is that when you start reading from the top, you may think from the sender's point of view only. I mean, you will be stepping into the shoes of a community health nurse who is going to be writing down this letter to a recipient. But unfortunately, to select the appropriate case notes and to ignore the irrelevant case notes, you need to think from the receiver's point of view. I mean, the person who is going to receive this letter. In other words, we can say a recipient or an addressee. Okay, so don't worry about these case notes at all. You have to scroll down to the writing task section immediately. So don't worry about all these things. Just go here and let's start reading the writing task. All right, let's read it. Using the information given in the case notes, write a refer letter to Dr. Sophie Mather, manager, William Valley Vascular Center, 2nd Street, Melbourne, Australia, 3000 for further treatment and investigation. So when you read the writing task at least twice, you should be able to understand a lot of information, okay, that are going to be essential for you to achieve your desired scores, especially 350, for example. So first and the foremost thing that you need to know is the recipient. To whom we are going to write a letter? That's the first question. We are going to write a letter to a doctor, okay, Dr. Sophie Mather. She's the manager in vascular center. Okay, so you need to think from the vascular point of view. Okay, all right. So that's a doctor who is working in William Valley Vascular Center in Melbourne, Australia. Okay, right. So let us think from this doctor's point of view and from this vascular arena. So that's how we need to think. All right, then only we will be able to get to know all the relevant case notes. Is this clear with everyone?
Yes, yes.
Okay, perfect. All right, Vibina, did you understand that? Menaga, I hope everyone understands this, right? Aishu, Denifa, Maninder, Vetri Selvi.
Yes, sir.
Yes, okay. Okay, perfect. All right, so let's start from here. So we need to step into the shoes of this doctor. We need to think from a doctor who is working in the vascular center. Okay, that's the first thing. All right, because this doctor needs to provide further treatment and investigation, carry out the investigation for this patient. Okay, we don't know anything about the patient yet. We have to go through them. Okay, so the first and the foremost thing we need to do is to go to the writing task section, read the writing task at least twice, understand the information regarding the recipient, and think from the recipient's point of view. Now we have to jump on to the case notes from the beginning. Okay, let's see the case notes from the top. Okay, so don't worry about this. It's all right. The doctors requested, okay, to provide home visit for your patient, Mr. Paul Shipton, today. So that's the patient details. Okay, see this one. The name of the patient is going to be Mr. Paul Shipton. Okay, that's the name of the patient. Okay, and then DOB is date of birth. That is 3 October 1946, aged 76-year-old. Okay, so let's say when you see the case notes in the question paper, you need to understand one thing, that the case notes will be full of note form. The case notes will be full of abbreviations. The case notes will be full of short forms and many more. In fact, you will also get to have incorrect spelling for the words, inappropriate use of punctuations, nouns, verbs, and tenses as well. As a result, you need to be mindful that you have to look at the case notes only to gather the information. Never ever assume that the question paper is correctly written from the grammatical perspective. From the grammar perspective, it is absolutely incorrect. It will have a lot of grammatical errors. Is this clear with everyone? That's the first thing we need to be mindful about. See this one, YO, when we have to expand, if needed, we have to expand in full only. Years old, you can't write like this. The same thing is applicable for DOB. When you write down the abbreviation, DOB needs to be expanded for sure, 100%. Okay. I always recommend my students to do that. You may ask me that the official OET letters have got DOB in their response, but please remember that it is only the sample letter. They didn't say that that's the ideal letter, and they also didn't provide 500 out of 500 for those sample letters. Have they provided? No, isn't it? They never said, they have never given the detailed assessment of the letter and provided the overall score for those letters, isn't it? It is just a sample letter. When you go through the writing task section, they will clearly state that you should not use note form. Do not use note form. Use what you can say, the sentence form, and that's how they use, isn't it? Write at least 180 to 200 words, something like that. So these are the instructions that you have to strictly follow. What happens if I can expand DOB into date of birth? Am I going to be penalized as far as the marks are concerned? No way. If you expand the abbreviations, there is no harm at all. But if you don't expand, the problem is going to happen that you may get the deduction of your score. So you may be deducted. As a result, don't give the chance for the examiner to reduce your marks. Okay, please be mindful about this. All right. Let's go through the social history. See this one, the social history is non-smoker. See, non-smoker, the actual spelling for non-smoker is going to be like this, isn't it? It's going to be a one word only. Am I right? But why they have given like this in 2 words? It is intentional. It is intentional. They are expecting you to interpret the information correctly. All right. If you write down non-smoker as 2 words in your letter, you will be penalized. You need to understand that the case notes will have lots and lots of grammatical mistakes, and you are the one who need to interpret the information correctly and get your desired scores. Okay, it's really important. And see this one, these ones are not at all correct from the sentence perspective as well. I mean, they are not complete sentences. Consume alcohol 10 glass weekly, that's it, right? Wife arthritis and depression, mother diabetic. So this means wife is suffering from arthritis and depression, and the mother has got diabetes mellitus. So that's what they are clearly stating from here, isn't it? Okay, firstly, let's go through here. Do we need to know the name of the patient? Okay, from the recipient's perspective, you need to think from here. From the recipient's perspective, who is going to be the recipient? It is the doctor, blah, 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 whoever it is, who is working in the vascular, clinic or hospital, right? So you have to think from the doctor's perspective. Do you really think from the doctor perspective and then pick this one up? Do we need to choose this case note? Is it really important to know the patient, or can I provide requested services or treatment to anyone? Is it really important from a doctor's perspective, from the recipient's perspective, to know the name of the patient? Can anyone answer this question? Is it really important? Amber, do you think so? Is it really important to know the patient, to find out the patient in the letter?
From my perspective, I think yes.
Yes, of course, because this is very, very important. Otherwise, we wouldn't know to whom we are providing the services, isn't it? So from the recipient's perspective, name is definitely important. Okay, you have to include it. So this is a relevant case note. You need to put a tick mark here. And regarding the date of birth, when you get 2 different information under the date of birth, for example, you get the date of birth as well as the age. It's preferred to use the age rather than the date of birth. All right. Okay, good. Now, it's a non-smoker, consume alcohol, 10 glass, and also with the wife arthritis and then depression. What do you guys think about this? Do we need to include all of them? Is it going to be really important? Do we need to include all the case notes?
No, sir.
No. Which ones can be included? Which ones can be excluded? You need to again think from the doctor's perspective. Okay, Sophie Mather. All right. Who is
Why?
working in? Yes.
So wife arthritis is not included.
Exactly. It's
And
not needed. Yes, you're right.
yes,
Absolutely. This is not
yes.
important. Perfect. Yes, good. What else?
And consume alcohol is included. You
Yeah,
need to
it is
include it.
included. Exactly. Yes.
Yes.
So is this going to be relevant to the recipient? If you think so, yes, then put a tick mark. What about smoking? Do you think the smoking can lead to some vascular problems? Is that going to be the case or no?
No.
No.
No, sir.
No.
No, sir.
So this can be excluded. Yes, put a cross mark
Yes,
here.
sir.
So when you have to do the planning in the beginning of a OET writing case note, you have to do this. Okay, you have to put the cross mark as well as the tick mark, against the incorrect as well as the appropriate case notes. Okay. And what about mother diabetic? Is it really important?
So partially important because
Yes.
if he is diabetic and we can write he's मतलब he's from he कह सकते
It's
हैं
a
जिसे
family history. Yeah.
hereditary है
Yeah,
hereditary कह सकते
hereditary could be one of the issues, right? It
Yes, sir.
can transfer,
Partially, sir,
yeah, the
it's
disease to
partially
some extent.
included.
Yes. So
Yes.
we can put a tick mark against this one as well as this one, isn't it? The remaining things are not important. Does everyone agree with this?
Yes.
Okay, perfect. Good. Now let's go through the medical history. Again and again, I'm telling you that you need to think from the recipient's perspective. Okay, always think from the recipient's perspective. Who is the recipient? The recipient is working in the vascular center. Okay, he's the doctor. He needs to provide further treatment and investigations. Okay, so for the management, it's a vascular surgeon, vascular doctor. All right. So please understand this. Keep this in mind, and then go through the medical history. Okay, let's go through the first one. High cholesterol in 2014, and then type 2 diabetes 2017, hypertension 2014, back pain, stomach irritation, history of ulcer, left leg 2019, and then treated by compression therapy at ulcer clinic, hernia repair performed. So we have got all this information under the medical history itself. So the patient has undergone several issues. Okay, the patient has been suffering from several issues here. So how do we find that out? Okay, let's say the first and the foremost thing again you need to think from the vascular surgeon's point of view. That's really important. Okay, is that clear with everyone?
Yes.
So just think about it. So what else is going to be the important case notes from this point of view? What do you guys think about it? What else can be excluded? Okay, let's think from the first point. High cholesterol. Is this going to be really important? Okay, the other issue is that you need to also ask you whether the recipient is a known case. I mean, does the recipient know this patient previously, or is this the first time the patient is going to be referred to the recipient? So that's going to be the next question, right? If that's the case, if the recipient already knows the patient's problems, patient's medical background in the past, you don't need to include all these things, isn't it? Only the relevant information needs to be included in your letter always. So please understand that. Okay. So in this case,
So
what's going to happen? Yes.
So first three is important.
Yes, first three are important.
Cholesterol,
Yes, they are.
diabetes, and hypertension.
Exactly. Yes, exactly. Yes. So vascular, for the vascular surgeon, for the vascular doctor, it is really important for him to know about these three things, because these are going to be affecting the vascular system of the patient. Does everyone agree with me?
Sir.
Yeah.
Yes.
Okay, perfect. Good. That's really good. All right. So once we put the tick mark against them, so put a tick mark here, put a tick mark here, put a tick mark here. Back pain is not important. And what about stomach irritation? Do you think stomach irritation needs to be known by
No,
the
sir.
recipient? No, vascular surgeon doesn't need to know about the stomach,
sir.
isn't it? So
Yes, sir.
you need to think from the recipient's perspective and think about their responsibility. So what kinds of responsibilities do they need to perform? As a vascular surgeon, okay, let's say, as a vascular surgeon, I don't need to worry about the back pain. I don't need to worry about the stomach irritation as well, isn't it? Okay.
Yes.
And what about the next one? History of ulcer in the left leg in 2019. Well, I believe this is going to be an unknown case, but let's have a look at it quickly. Has the patient ever visited the recipient in the past? Let's have a look at it. I don't think so. No, not until now. No, they didn't say anything about the recipients organization here, or they didn't say anything about the recipient's visit to the doctor. So it's going to be the first time referral letter. So it is an unknown case. Okay. So let us think from that perspective. Okay. It is an unknown case. So is this going to be really relevant, for the recipient to understand this information? Is it really important?
Yes.
I think so. Yes. Good. And what about the other one, hernia repair? Do you think
So
hernia is going to be?
sir, it should include it.
Are you sure hernia is going to be the one for the vascular?
No,
I don't
for the
think so.
ulcer in the left leg is more
Yes.
significant.
Yes, I don't think hernia repair is going to be relevant in this case. I don't think so. Does anyone have disagreement with me, please? Anyone else?
Yes, hernia is not included, right?
Exactly. That's what I'm saying. Does anyone disagree with me? Does anyone disagree with me and Amber? Vitiselvi, what do you think? Is this going to be a relevant case note or an irrelevant case note?
Irrelevant.
Sorry, sir. I never see the doctor. What?
Doctor,
Half-yearly
vascular surgeon. The doctor is a
so
vascular surgeon.
then it's no need for that. I think
Yes.
so. If it is vascular, it is no need doctor.
Yes, we don't need to include this information for the vascular doctor.
Only
Vascular
unless
doctor.
there is any cardiac issue, we can include doctor.
Exactly, you're right. Exactly, 100%. Yes, I agree with you. Yeah, definitely. Yes. So we need to think from the recipient's perspective. It is going to be of great help for us to get the the 100% matching information. Okay, and let's look at the current medications. Okay, right. So we don't include this one. We put a cross mark against this. We put a cross mark against this. All right. So when you put the cross mark, it is going to be pretty easy for us to ensure that you don't include all those irrelevant things in your letter. Is this clear with everyone? What happens if we don't place the cross mark while planning the answer for the letter? It's going to be pretty hard. Sometimes you may include the irrelevant case notes by mistake while you write down the answer. So it's better to put a cross mark, or you can also strike that out as well. You can just strike that out using a pencil. You can just draw a vertical line across the words. Across the notes that are irrelevant. Is this clear with everyone?
Yes.
Okay, can we go through the next one? Current medications. These are the medications that the patient has been taking at the moment. So one is the metformin, that is diabetes mellitus. And the second one is atorvastatin, it's for the cholesterol. And then ibuprofen, it's for the back pain. And then amlodipine, that is HTN. And then omeprazole, that is stomach irritation. So what medications do we need to include? Okay, let's say there are a couple of clues, on which one should be included and which one should be excluded. You can scroll down to the discharge and see whether they have got any information in relation to, okay, let's see this one. Atrial insufficiency. Did they mention anything in regards to the medications and the medication regimen or medication compliance and things like that? So we need to have a look at it. Okay, so let's see that. I don't think anything, but still all these medications may need to be included, but let's go through them one by one. Let's see the first one. So metformin for diabetes mellitus, is that relevant to the vascular surgeon?
Yes.
Yes, sir.
100%, right? You put a tick mark. Cholesterol, do you think if we have more cholesterol, the chances of getting the heart diseases is increased? Do you agree with me? Okay, can someone disagree with me? If someone is really fat, they will not have heart disease at all. Being fat actually reduces the heart diseases. Is that so? No, right? It is going to increase it. So which means this is important. So think from the recipient's perspective, it will be pretty easy for you to select only the relevant case notes. Okay, ibuprofen for back pain. I don't think this is really important for us. No, from the vascular surgeon, he doesn't need to know whether this patient has got back pain or something, isn't it? It's not going to be important. But what about the next one? Is that going to be important? I think it may be. Maybe semi.
Amlodipine is important only.
Yeah, so this is important, yes. And then what about the next one, stomach irritation? Is that going to be relevant to the recipient?
No, sir.
I don't think
No,
so.
sir.
Stomach irritation, we don't need to worry about that, isn't it? But again, okay, let's have a look at it. Sometimes the vascular doctor may prescribe some kinds of food or, to improve the, the well-being of the heart, in which case it may be important, isn't it? But let me have a look at it quickly, what they are going to do. Failure to inform doctor, diameter, also pain is increasing. So yes, I don't think this can be important. We can remove it. Okay, so we can definitely remove this one. Okay. All right, perfect. Good. Okay, so we are going to include only metformin and then atorvastatin and amlodipine. Okay, that's it. So these three medications can be included. We don't need to include ibuprofen or omeprazole, unless if the question has got really less relevant case notes, you can include it. And if you cannot, achieve at least 170 words in your letter, you may include these two medications because they are the current ones. Otherwise, you don't need to. At the moment, I don't want to include these two medications. Okay, ibuprofen for the back pain and the one for stomach irritation don't need to be included. Okay, now let's go through this. So it's going to be 16 December. That's this. Okay, see this one. They don't even expand the name of the month. So in the question, it's going to be, it's going to be really difficult for us to understand the information because it will be full of, short forms, abbreviations, acronyms, and so on. But your task is to expand them and present them in the appropriate manner. Okay, so please understand that. So the next one is 16 December 2022. Diagnosed with the pneumonia following suggestive symptoms, that's fever and feel chesty. Community health nurse visit arranged today. Wow. So this is the today's date, isn't it? So what does that mean? This mean, okay, when you write down the letter, we need to write down this date only. Isn't it? Is this clear with everyone? Right? So home visit is already arranged. All right. Okay. Now, 17 December 2022. Okay. But now we need to ensure one thing, that this visit is arranged by the community health nurse, but the sender is the community health nurse, which means we don't need to worry about this, but we need to worry about the date. And the other issue is on the 16th of December, we need to again check with the pneumonia. Do you think pneumonia could be relevant to the vascular? Is it true?
No.
No. What about
I
others?
think-
Yes. I think pneumonia may be important. I think it
So
is. It may be important. What do you guys think about it?
Yes.
Yes, others. Yeah, Managa, what do you think about this? Because this is an unknown case, but pneumonia, when you have pneumonia, when a patient has got pneumonia, what's going to happen? What kinds of, do you think the heart may be affected to some extent if it gets worsened?
Yes, sir.
Maybe, right? Yeah, when you think from the vascular surgeon point of view, some case notes may look like irrelevant, but again, you need to think and ask the question, okay, is pneumonia going to affect the vascular system to some extent? So if you ask this, but I don't need to worry about, suggestive symptoms, okay, but means diagnosis has been already made. So I want to go through only the pneumonia, that's it. I don't need to write down, the suggestive symptoms of, fever and chesty. I don't want to do that. It's not needed. All right. And yeah, let's go ahead with the next one. Okay. All right, home visit, 17 December, home visit 2022. Okay, recovering well from pneumonia. Okay, so he has been recovering well from pneumonia anyway, so that's good. And then feel improved breathing. All right, a reported ulceration on right calf. When you look at this, usually after on, when you write on the body part, we need to use either the or his or her, isn't it? But when you look at the case notes, they didn't write this down. Why? Because it's the case notes, it's a notes form. They will definitely have incorrect use of articles, prepositions, everything, you know. So it is, from the grammatical perspective, it is rubbish, I would say. All right. From the information perspective, it is very important for us. That's it. So we need to get the information only. Don't worry about the, what do you call, the grammar. All right. The grammar is not going to be 100% correct in the question paper. So please understand this. All right. Okay. Let's go through the next one. Untreated trauma 6 weeks ago following fall at home. Failed to inform doctor. Now diameter of ulcer and pain is increasing. Okay. From the whole date, okay, from the home visit and, you know, recovering well from pneumonia. As we have previously mentioned that recovering well from pneumonia, you have to mention, this is going to be the important note as well. However, these two things should be, you know, included together. Do you know what I'm saying? I mean, when you say diagnosed with the pneumonia, however, she has been recovering well from that. So you can write like this. All right. So you can write these two things in it together as well in one sentence. You don't need to separately write them down. All right. Is this clear with everyone?
Yes, sir.
Okay. Now let's go to the next one. So feel improved breathing. Do we need to mention this when we say recovering well from pneumonia? Is it hidden under the pneumonia? When you, okay, let's say, let me ask you the question in a different manner. Okay, if you are able to recover well from pneumonia, do you feel your breathing much easier? Are you able to breathe well, right? I mean, they are telling the same information twice in two different ways, isn't it? This is a trap. Unfortunately, this is a trap. I mean, they want you to write down the same information twice so that they have an evidence to deduct your mark. They will reduce at least 10 marks or 20 marks if you include this information as well, because it's the same information. You know, when you're recovering well from pneumonia, obviously, you know, your breathing is getting much better. That's what it does mean, isn't it? So we should ensure that we don't include the same information twice. No way, we should not. Is that clear with everyone? Okay, now the next one. Reported ulceration on right calf. Is it really mandatory? So ask yourself, from the vascular surgeon point of view, is it important?
It is important.
It is, yes. So just, you know, put a tick mark. I think it has been incorrectly spelled.
Yes.
It's not, it's going to be CALF. It's not CAUGH. Okay, yes. All right. And what about untreated trauma 6 weeks ago following fall at home? When someone, you know, falls down at her home, what's going to happen? You know, if there is a trauma, is that going to be affecting the heart system? Is that going to be affecting the cardiovascular function? Is it somewhat
No, sir.
relevant or not?
No, sir, it's not relevant.
Are you sure? Okay,
No,
what
it's
about,
relevant to the vascular ones, doctor.
yeah, Amber, what do you
It
think
will
about
relate
this?
to the vascular. Sometimes
Sir, I think trauma will aggravate more his condition.
Exactly, you're right. Absolutely, yes. So 6 weeks ago, I mean, the patient has had a fall, and then it hasn't been you know, told to the doctor. See this one, failed to inform the doctor, isn't it? So the doctor didn't know this. You know, the previous doctor didn't know this. Okay, so it's untreated. So it can. So to some extent, this is important, but it's not. I mean, it's not fully relevant. I would say it can be semi-relevant. Okay, so it is better to include in the letter. Okay. All right. Failed to inform doctor. Yes, 100%. Why? Because they didn't know anything about this incidents, right? So you have to include them, please. Is this clear with everyone? So the current doctor is, you are working with the current doctor, and the current doctor doesn't know anything. And you are sending this patient to a different doctor, different cardiovascular doctor, vascular surgeon, who is going to, receive the information, receive the patient. So this is important. You need to tell that, yes. And what about the diameter of ulcer and pain is increasing? Is it relevant as well? What do you guys think about it? Do we need to include this?
Yes, relevant.
Yes, it is relevant. Yes. So you have to include this as well. So against all the relevant case notes in the actual examination, you need to put a tick mark, and then against the irrelevant case notes, you need to put a cross mark. Only this can save you from not duplicating the same thing, not adding the irrelevant ones in your actual letter. All these things are going to help you out a lot. So ensure that you are 100% confident on what you're going to include and what you're not. Okay. All right, let's go to the next one, the objective. Let's read from there. Okay. So odematous knee with wound measurement to inner ankle. So what do you guys think? What about this case note? Is that going to be a bit important or not?
Sir, it is important.
Yes. Okay, so we can include that. And what about the other one? The next one, scar tissue formed in skin bed, less hemolytic exudates present. Is that going to be important as well?
Scar tissue.
Scar tissue. I hope it is important, because surgeon, okay, what the surgeon is going to do? Do you think the surgeon is going to operate the skin of a patient, or do they do without cutting the skin of the patient? What do you guys think? I hope a surgeon needs to operate, isn't it? I mean, cut the skin, or they do something with skin. I believe scar tissue formed in skin bed may be relevant. I believe so. May be relevant. I would say maybe, yeah, I would say, I mean, again, like not fully relevant, but I would say maybe semi-relevant. All right.
It's semi-relevant.
Yeah, the problem is, yes. The other
report
issue,
is pending.
yeah, surgery. I believe, when you go through this one, they said ulceration with the mixed etiology and artificial insufficiency, they may have a look at it and assess them, and then possibly do some kinds of surgery, isn't it? If that's the case, then, okay, just think about all these things. Okay, is that going to be relevant? Yes, maybe, right? Maybe. Yeah, so we can tick that as well. What about skin culture? Is that going to be relevant? Skin culture? I don't think so. The report is pending anyway. But what do you guys think? Is that going to be relevant?
It's semi-relevant.
Sorry, Amber, what do you think, Amber?
Sir, I think because in order to decide if antibiotic, skin culture mostly taken.
So it could be. Okay. So this can be, yeah, this can be included, but the report is pending, right? Skin culture has been taken, but the report is pending. So we have to highlight this. If it is pending, we have to tell that, yes.
Yes, sir.
Okay. When there is no obvious signs of infection, do we need to include it? I mean, for the good things, we don't need to. Usually, when you write a letter of referral, to someone urgently, this is going to be an urgent referral, I believe so, because yeah, so see this one they have mentioned in the plan, urgent referral. Okay, so it is important. You don't need to include, there are no signs of infection, but because it's all right, right? We don't need to worry about that. But what about the next two case notes? What do you guys think about this? What is arterial, where it is located? Is it located in the heart system, or is it located in the knee, or in the foot, or in the leg?
Leg?
Arterial? No, I don't think so. Ulceration with the mixed, ulceration with the mixed etiologies. Yes, exactly, that's right. But do you think this can be related, this can have an impact from the cardiology perspective? Is that true?
Ulceration with mixed cardiology.
Yeah, from the vascular system, is that going to be an important one?
Sir, in order to provide the provisional diagnosis, I think we
Yes.
should include these two.
Yes, that's correct. So the current diagnosis is not, it's only suspected. When you see the question marks, it's only suspected. They are suspecting that the patient may have ulceration with the mixed etiology and artificial insufficiency as well. Maybe. So it's not sure, it's not 100% confirmed. It is only suspected. It is actually the sender is actually doubtful. It could be. So only the receiver needs to confirm these two things. Okay, so we have to include these ones as well. They are going to be relevant to the vascular surgeon, right? Okay, what about the management? So management is the one what they have done. All right, but okay, so these are the ones where they have done. Okay, now do I need to know what has been done to the patient previously? Remember that I don't know anything about the patient. So do I need to know what kind of treatment or what kind of preliminary procedure has been done for this patient? Do I need to know this or not? I need to know, isn't it? Obviously, right? Without knowing that, how can I provide further treatment? See, I need to provide further treatment and investigation. So without knowing what they have done in the beginning, how can I provide the further treatment? Is that clear with everyone? So I need to know all these things if they are relevant. Okay, cleansed with the normal saline, is this relevant? I think so. And what about dressing, non-adhesive type? See this one here, what they have done is, okay, for non-adhesive, if you look at it, non-adhesive, they should have placed a hyphen in between, isn't it? They didn't. So these are usual as far as the question paper is concerned. You will have lots of mispresentations of the information from the grammatical perspective. Okay, and then absorbing bandage, yes, of course. Urgent referral to vascular surgeon for management, yes, 100%. So all these things are going to be relevant from the recipient's perspective. Is this clear with everyone?
Yes, sir, I have a question.
Yes.
Sir, in objective, it's written that no obvious signs of infection. So it seems to be a positive thing that we have to write that one and we have to mention as well.
No, if there are no issues, if there are no signs of infection, we don't need to. Only the negative issues will be written down. You don't need to write down the positive ones. Positive means, it's okay. Yes, in this case, there are no issues at all. Okay, so if there are no issues, you don't need to include all those case notes. Okay, and already the case notes have got lots and lots of information, isn't it? So from the beginning, it has got so much information. So we can't write down all these things, using 180 to 200 words itself. So this is the way we need to analyze the case note. So we have to go from the recipient's perspective, and then we have to understand the information so that we should be able to find out the relevant case notes and then place the tick marks against them, and then the irrelevant case notes and place the cross marks against them. So these things are quite essential. Is that clear with everyone?
Yes, thank you.
So knowing the right information, knowing the relevant information and the irrelevant information makes our job easier. That is the primary goal of the OET letter. We need to ensure that we don't include any irrelevant case notes in our letter. All right.